How do doctors diagnose urinary retention in the bladder? Have you ever wondered how doctors figure out if someone is experiencing urinary retention? It's a common issue that can affect bladder health, and understanding the diagnosis process can be quite enlightening. Doctors primarily diagnose urinary retention by assessing how much urine remains in the bladder after a person tries to urinate. This is combined with a detailed medical evaluation to identify any underlying causes. The diagnostic process typically starts with a thorough medical history and symptom review. Doctors will ask about any difficulties related to urination, such as trouble starting, a weak stream, or feeling like the bladder isn't fully empty. They will also inquire about previous urinary problems, any surgeries, medications, and relevant health conditions like prostate issues or neurological disorders. Next, a physical examination is performed. This includes palpating the lower abdomen to check for bladder distension. For men, a rectal exam is often done to assess prostate size and check for fecal impaction, which can contribute to urinary retention. In women, a pelvic exam may be conducted. Additionally, a neurological evaluation is important to check for nerve-related causes that might affect bladder function. One of the key tests in diagnosing urinary retention is measuring the post-void residual volume, or the amount of urine left in the bladder right after urination. This can be done in a couple of ways. Doctors may insert a catheter into the bladder to drain and measure the residual urine. Alternatively, they might use a bladder ultrasound, which is a non-invasive method to estimate how much urine is left. A post-void residual volume greater than about 150 milliliters, which is roughly half a cup, is generally considered abnormal and indicates urinary retention. Laboratory tests also play a role in the diagnostic process. A urine analysis can help detect infections, blood, or other abnormalities that may be causing or resulting from retention. Blood tests can assess kidney function and check for systemic conditions like diabetes that can affect bladder health. In some cases, doctors may order imaging studies to identify the causes of retention. This could include an ultrasound of the kidneys and bladder to look for stones, tumors, or structural abnormalities. More advanced imaging, such as computed tomography or magnetic resonance imaging, might be used to evaluate for masses or prostate enlargement. Cystoscopy is another option, where a thin camera is inserted through the urethra to inspect the bladder and urethra directly for blockages or tumors. Urodynamic studies may also be conducted to assess bladder muscle and sphincter function, especially if there are concerns about neurogenic bladder or complex dysfunction. For men, prostate-specific antigen blood tests may be performed to screen for prostate cancer or benign prostatic hyperplasia, which can cause urinary obstruction. In summary, diagnosing urinary retention involves confirming incomplete bladder emptying through post-void residual measurement, along with physical examination, laboratory tests, and imaging studies to determine the underlying cause. This comprehensive approach is essential for effective management, especially in the context of bladder health and bladder cancer, where obstruction or tumors may contribute to retention. If you experience symptoms suggestive of urinary retention, it is important to seek evaluation by a healthcare professional for accurate diagnosis and appropriate treatment.